What I tell my patients who probably are on long-term follow-up and then become sick, probably they have symptoms suggestive of COVID, or what I tell people in general whenever there's a talk is, whatever we said, self-monitoring, this applied very well during the first wave because there was a set pattern of progression of illness. We knew up till day 4 to day 6, you'll have fever, and after that anyway, you'll get better if at all your immunity is otherwise well. Now, the second wave has puzzled us, it has kind of shook us, and then it has made certain things unbelievable. So at this point of time, what I would generally suggest is, if you're someone whose health is otherwise well, you're constantly monitored your health, you're keeping well otherwise, you're less than 50-year-old, and you're monitored your blood parameters, have a regular health check done. If you have some symptoms, fever, headache, sore throat, cold, for the first 2 days, yes, take paracetamol, maybe something like a cetirizine. But if you have these symptoms continuing or going on for more than 48 hours, please do consult a doctor. If you're someone more than 50, if you're someone with diabetes, hypertension, body weight more than what is expected for the height you have, please do not wait at all. The day your symptoms begin, at least have an approach, at least talk to a doctor and then get to know what you should do next. Now, what happens after you see a doctor depends on the expertise and the level of knowledge that your doctor might possess. I do hope that doctors update themselves time and again. Now, blood tests are not mandatory for everyone. So what we have as a policy here is we do look at the level of immunity again. Somebody who looks very sick, somebody who has risk factors like bad diabetes, hypertension, which is not under control, or any of the chronic kidney, liver, lung, or heart illness, we do ask for a blood test by day 3 to day 4. But if someone is healthy otherwise, we monitor them, give them symptom control medication, we keep them under follow-up, tell them to inform us if at all something is not all right with you, and then let us know if something goes wrong. So we monitor them up to day 5 to day 6. Only if they are not getting better by then, we ask for certain blood tests which are very basic, some inflammatory markers which are also not exotic, and then we monitor. CT scan as a routine, most of us really do not believe in that. There is a big hype and there is a big discussion going on that the RT-PCR and any similar tests are not good enough. They do not pick the test even if you have illness, and hence CT becomes mandatory. I think this is a wrong information. CT would become essential only in those individuals where oxygen level is dropping or is less than 94%, or in those individuals who have, like I listed previously, immunocompromised. Please do not ask for a CT. It is a lot of radiation exposure. We can still diagnose with RT-PCR. Say, for example, you are someone who's well. Your RT-PCR you did on day 1 or day 2. It is expected to be negative in about 30% of the cases. So you still continue to have symptoms. We ask you to come back after 48 hours. By day 4 to day 5, we repeat your test. If you truly have the illness, it will come positive and we'll manage. Irrespective of your test, the treatment remains the same. Please remember, time and again, I'm reiterating, the treatment depends on the symptom you have, the background illness you have, and the symptom severity that you have. Neither CT nor blood test will help us understand the severity unless until your symptoms correlate with them. So let your doctors decide when to do the blood test and when to do the CT. CT from the word go is a big no.